Diflunisal is an NSAID used to treat mild to moderate pain, inflammation, osteoarthritis, and rheumatoid arthritis. In this video, let's find. What is Diflunisal? What is Diflunisal used for? Contraindication. What are the side effects of taking Diflunisal? How does Diflunisal work? How to use Diflunisal? What is Diflunisal? Diflunisal is a salicylic acid derivative with analgesic and anti-inflammatory activity. It was developed by Merck Sharp and Dohme in 1971, as 647 Malawian kwachas, after showing promise in a research project studying more potent chemical analogues of aspirin. Diflunisal is an NSAID used to treat mild to moderate pain, inflammation, osteoarthritis, and rheumatoid arthritis. In this video, let's find. What is Diflunisal? What is Diflunisal used for? Contraindication. What are the side effects of taking Diflunisal? How does Diflunisal work? How to use Diflunisal? Contraindication. Hypersensitivity to aspirin/NSAID-induced asthma, AERD, or urticaria. Third trimester pregnancy. Coronary artery bypass surgery, periop pain. Side effects. Increased risk of GI events including bleeding, ulceration, and stomach or intestine perforation. Abdominal pain or cramps. Constipation. Gas. Diarrhea. Nausea and vomiting. Dyspepsia. Irregular heartbeat. Possible increased risk of serious and potentially fatal cardiovascular thrombotic events, MI, and stroke. Risks may increase with duration of use and for cardiovascular disease history. Ringing in the ears. Yellowing of eyes. Side effects. Increased risk of GI events including bleeding, ulceration, and stomach or intestine perforation. Abdominal pain or cramps. Constipation. Gas. Diarrhea. Nausea and vomiting. Dyspepsia. Irregular heartbeat. Possible increased risk of serious and potentially fatal cardiovascular thrombotic events, MI, and stroke. Risks may increase with duration of use and for cardiovascular disease history. Ringing in the ears. Yellowing of eyes. Mechanism of action. The precise mechanism of the analgesic and anti-inflammatory actions of Diflunisal is not known. Diflunisal is a prostaglandin synthetase inhibitor. In animals, prostaglandins sensitize afferent nerves and potentiate the action of bradykinin in inducing pain. Since prostaglandins are known to be among the mediators of pain and inflammation, the mode of action of Diflunisal may be due to a decrease of prostaglandins in peripheral tissues. Half-life. 8 to 12 hours. Dose. Pain. 500 to 1000 mg PO first dose, then 250 to 500 mg PO Q8-12HR, not to exceed 1.5 g/day. Osteoarthritis. 500 to 1000 mg PO daily divided Q12HR. Maximum dose, 1500 mg per day. Rheumatoid arthritis. 500 to 1000 mg PO daily divided Q12HR. Maximum dose, 1500 mg per day. Safety advice. US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about Diflunisal we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.